Next, we're going to look at what's called the straight leg raise test. The straight leg raise test tries to, again, stretch the nerve that's trying to come out of the spine, make the hole for that nerve a little bit smaller, and so we're looking for reproduction of symptoms that might come from a nerve being pinched on by something like a herniated disc in the low back. So on the right side, I'm going to lift the leg up, and I'm going to ask him if any of this reproduces his symptoms as we go.
No.
He's relaxing. I'm doing the lifting here. And now if you can visualize, if there is a herniated disc in his back, his spine's going to line up this way. The discs, when they bulge out, usually bulge out in the downward direction, and underneath those bony and disc elements is where the spinal cord and the nerve roots run. So if there's a disc herniation that is coming down and pinching and irritating a nerve root as it's trying to exit the spine and head down towards the leg, by me stretching his leg up in this direction, you can envision me pulling the nerve as it's heading down into the leg tighter, the sciatic nerve back here, and it'll bring it up into that disc that might be herniated out from the front down towards the bottom. And so it will irritate that nerve root a little bit more, that nerve root that contributes to the sciatic nerve. Usually when people complain of the pain that goes down into their legs, it'll happen, well, not just when we lift his leg 2 degrees, but usually when we kind of get it up a little bit, about 10 degrees or so, and somewhere between 10 degrees and about 60 degrees is when we should have that complaint of pain that goes down into the legs reproduced to be considered a positive straight leg raise maneuver. Next test is called the Faber test. For the Faber test, we're going to be looking either for hip or low back pathology. Faber is simply an acronym for flexion, abduction, and external rotation. So what I have folks do is kind of bring their hip up, kind of cross their ankle on their knee. I'll try to stabilize the opposite side, and then we'll have them relax their knee down towards the side. So they've got hip flexion, abduction, and external rotation. We'll stress it here just a little bit and ask them if there's any reproduction of pain. If the reproduction of pain is in the lower back, we tend to think of this as a sacroiliac joint test. On the other hand, if they complain of pain in the hip, then it's more consistent with hip arthritis. And we'll compare from side to side. So again, flexion, abduction, and external rotation as we kind of stabilize out here. Lastly, let me have you roll towards me onto your stomach. This is something called the femoral stretch test. The femoral stretch test is like the straight leg raising test, only now we're looking at the femoral nerve. So again, the spine and the discs are up here. The femoral nerve exits higher up and comes down the front of the leg. So what we do in this test is we actually stretch the front of the leg by having him bring his knee into flexion, and then we'll give him a little assist. We'll just kind of pull the thigh into extension. So we're stretching that femoral nerve down the front part of his thigh up into that disc that might be bulging down, and so we're trying to irritate the femoral nerve. In this case, we'll look for reproduction of pains or nummy tingly sensations over the anterior thigh where the femoral nerve supplies the muscles. We'll do that on each side. Bring it up, and then I'm going to stretch you up here again. Good. Any reproduction of pain or numbness or tingling over the front of your thigh?
Nope.
Good. Okay.